Have you ever had that moment, where you find a little damp spot on the carpet or the
Oh,
bed
sure.
and you realize, oh, it's the dog? Or maybe you know someone whose cat does this.
Right. It's instantly worrying when that happens. You wonder what's up.
Exactly. You start wondering, okay, what's really going on here?
It's definitely a concern for any pet owner, yeah.
Yeah.
And understanding the cause is the first step, absolutely.
And that's precisely what we're diving deep into today. We're going to tackle urinary incontinence in dogs and touch on cats a bit, too.
Hmm.
We've been digging into the information from veterinary urinary incontinence in dogs and cats,
Right.
trying to get a clear picture of, what it is, why it happens, and really importantly, what you can actually do about it.
Yeah, our aim is to give you a really solid overview, help you spot the signs, understand the underlying reasons, and know what options are out there.
Okay.
And we want to do it without, drowning in super technical medical terms.
Perfect. So let's start right there. What is urinary incontinence in simple terms?
Okay, yeah. So basically, it's when your pet just loses that voluntary control over urination.
Right.
So you see involuntary leaking.
Mm-hmm.
And the key thing, really, is that it's usually a problem with storing the urine.
Storing it. Okay. So the bladder's job of holding on to it.
Exactly, holding it until it's time to go. That's where the breakdown usually happens.
So if it's a storage problem, how does that actually fail? What goes wrong?
Well, there are basically three main ways that storage mechanism can fail.
Okay.
First, the bladder itself might not, stretch properly. Impaired bladder accommodation is the term.
Like it can't expand enough to hold much?
Pretty much, yeah. Think of it like a balloon that's kind of stiff and doesn't inflate well.
Gotcha. What's the second way?
The second is a failure of the urethral continence mechanisms. So
Yeah.
the urethra, that's the tube leading
The
out.
valve, sort of.
Exactly, the valve mechanism. The muscles and structures there need to stay closed tightly. If they don't, urine leaks out.
Makes sense. And number three.
Number three is what we call anatomic bypass. So the urine basically takes a detour around the normal storage parts.
Oh, okay. Like a plumbing problem.
Kind of, yeah.
Yeah.
We'll get into the specific examples like ectopic ureters later. And it's also worth quickly mentioning overflow incontinence.
Overflow.
Yeah, that's when the bladder gets super full, maybe because something's blocking the exit slightly, and the pressure just builds up so much that urine is forced out.
Like a dam overflowing.
Exactly like that.
Okay, that paints a clear picture of the how. Now, who does this usually affect? Is it common?
It's actually more common than you might think, especially in certain dog populations.
Really?
Yeah, the source points out that around 20% of spayed female dogs might experience it.
20%. Wow.
Yeah, especially in larger breeds. That's quite a significant number. It really highlights how spaying, maybe the hormonal changes, can affect that urethral valve strength, particularly in bigger dogs.
That's huge. Are there other patterns, like age or...
Definitely. It's most common in middle-aged to older females who've been neutered. But you do see it in younger females sometimes, too.
Okay.
It's less common in neutered males and pretty rare in cats overall.
But the main takeaway is medium to large breed, neutered females are the most common group.
That's the biggest group, yes. Absolutely.
Okay, so we know what it is, who gets it. Now the big question,
Why?
why? What are the actual root causes?
Okay. This is where it gets pretty interesting because there isn't just one answer. We can sort of group the causes.
Right.
One major category is neurologic problems. Anything that disrupts the nerve signals controlling urination.
From the brain down.
From the brain, down the spinal cord, all the way to the bladder and urethra. If those signals get messed up, you can get incontinence.
Can you give an example? Like, how would a nerve issue cause leakage?
Sure. So imagine damage to the nerves, low down in the spinal cord, say from an injury or a slipped disc.
Okay.
That can sometimes lead to a bladder that gets really, really full, but can't empty properly. It just keeps filling and then overflows.
The overflow type you mentioned.
Exactly. But then if the problem's higher up, maybe in the brain itself or the cerebellum, which controls coordination,
Yeah.
that can interfere with the voluntary control, leading to maybe more frequent, smaller leaks because the off switch isn't working quite right.
So different nerve issues, different leak patterns. Okay.
Yeah.
What's another big category of causes?
The next one involves problems with the bladder's storage function itself, not the nerves, but the bladder muscle or wall.
Okay.
So the bladder muscle, the detrusor, might become unstable or like twitchy. It contracts when it's supposed to be relaxing and filling.
So it squeezes urine out when it shouldn't?
Precisely. That's called detrusor instability.
Hmm.
Or the bladder wall itself might just not stretch very well, like we talked about earlier. Poor compliance.
And what makes the bladder act like that? Infections?
Infections, definitely.
Mm-hmm.
Or chronic inflammation, maybe tumors, even pressure from something outside the bladder. Partial blockages can irritate it too.
Hmm.
And sometimes pets are just born with bladder issues. Interestingly, in cats, that twitchy bladder thing has been linked to feline leukemia
Oh,
virus.
wow.
Yeah. In dogs, though, the cause of that instability is often just unknown, idiopathic.
Okay, so nerves, bladder storage problems. What else?
Then we have urethral disorders,
Mm-hmm.
problems with the valve or the tube itself.
Right, keeping the exit sealed.
Exactly. Sometimes weak from birth, congenital weakness. More often, though, it's an acquired weakness.
Like the hormone thing after spaying.
That's the big one. Hormone-responsive incontinence is super common, especially in female dogs after they're spayed. But infections, inflammation, even prostate issues or prostate surgery in male dogs can weaken the urethra's closing ability.
So hormones are really key for that valve function in females. Interesting. Any other major cause categories?
Yep, anatomic causes. These are actual physical, structural abnormalities.
Like the plumbing being wrong.
Basically, yeah. A classic example is something called ectopic ureters.
Okay, what's that?
Normally, the tubes from the kidneys, the ureters, plug right into the bladder.
Right.
With ectopic ureters, one or both tubes connect somewhere else, maybe too far down the urethra, or even into the vagina in females.
Oh. So urine bypasses the bladder control.
Exactly. It leads to constant or near constant dribbling, often noticeable from a very young age.
I think I've heard of that. Any other structural issues?
Yeah. There's something called a patent urachal remnant. Before birth, there's a tube connecting the bladder to the belly button.
Okay.
It normally closes up. If it doesn't, urine can actually leak from the umbilicus, the belly button.
Wow, really?
Yep. And also, in female dogs, the shape of their vulva or the skin folds around it can sometimes cause urine to pool there after they urinate.
And then it dribbles out later.
Right. And we also mentioned bladder neck position earlier. If it sits too far back in the pelvis, that can contribute to urethral weakness too.
That's quite a range of physical possibilities. You also mentioned urine retention briefly before. How does that cause incontinence?
Right. So if the bladder can't empty, for some reason, maybe a blockage or nerve issue preventing emptying, it gets overfilled.
Mm-hmm.
And eventually the pressure inside just gets so high, it forces urine past the urethra. Overflow incontinence again.
Got it.
And it's really, really important to remember, especially with dogs, it's often not just one single thing.
Ah, so it can be a mix.
Very often, yes. You might have, say, some urethral weakness, and maybe a low-grade infection, or some anatomic factor combined with hormonal changes. It gets complex.
That makes sense. So diagnosis must sometimes be like putting pieces of a puzzle together.
It definitely can be.
Thinking about susceptibility then, are there specific things that make a pet more likely to develop incontinence? Risk factors?
Yes, absolutely. We've touched on some already. Neutering is a big one, particularly spaying female dogs, and especially large breed female dogs. That significantly increases the risk of urethral incompetence.
Okay.
And interestingly, the timing seems to matter too. Spaying female dogs very early, like before 3 months old,
Yeah.
that also seems to bump up the risk.
Before 3 months. Why is that?
Well, the thought is it might interfere with the normal development of the urethra and the supporting tissues, maybe related to those hormonal influences needed for full maturation.
That's really important for owners considering early spaying to know. What other risk factors are there?
Physical things, like we mentioned, the position of the bladder neck, how long the urethra is. In females, other vaginal abnormalities might play a role.
Okay.
Obesity is another one. It's been linked as a contributing factor, again, particularly in spayed female dogs.
Weight matters too, huh?
Seems so. Then there's some breeds just seem more prone to certain types, maybe genetically,
Mm-hmm.
of larger size in general too.
Right.
And anything causing the pet to drink and pee, a lot more polyuria that won't cause incontinence. But it can definitely make existing, maybe mild incontinence, much worse or more obvious.
Because there's just more urine constantly flowing through.
Exactly. And one more, slightly less certain, but some studies suggest early tail docking in certain breeds might be linked.
Tail docking? Really? How?
The mechanism isn't fully clear, maybe related to pelvic muscle development or nerve supply changes, but it's been proposed as a potential factor in some cases.
Huh. So it's a real mix of genetics, surgery, anatomy, weight, other health conditions.
It really is. Lots of potential contributing factors.
Now, if you're an owner and you're seeing accidents, How do you know if it's true incontinence versus something else? Because pets pee inappropriately for other reasons, right?
Absolutely crucial distinction to make. True incontinence is involuntary leakage, but pets might urinate in the house voluntarily for behavioral reasons.
Like anxiety or marking or just not being properly house trained?
Exactly. That's totally different and needs a behavioral approach, not a medical one for incontinence.
Okay. What else might look like incontinence?
Sometimes discharges from the urethra or vagina can be mistaken for urine, like with a vaginal infection or maybe prostate fluid in males.
Ah, right.
And in cats, you've got things like urine spraying that's marking behavior or just deciding they don't like their litter box anymore and going elsewhere. Again, voluntary, not incontinence.
Okay. And you mentioned polyuria, the excessive urination.
Yes. If your pet suddenly starts drinking gallons and having huge pees, they might just not be able to hold it, especially overnight. That looks like incontinence, but the root cause is whatever's making them drink so much.
So you treat the drinking issue first.
You investigate the cause of the polyuria, yes. And a simple urine test, checking the concentration, the specific gravity, can tell us if the urine is really dilute, pointing towards polyuria.
Okay, so first rule out the lookalikes. Then, if it does seem like true incontinence, how does the vet start figuring out which cause it is? Are there clues in the symptoms?
Yes, definitely. The pattern of leaking and any other kinds are really helpful.
Like what?
Well, if it's neurologic, you might feel a really large, full, maybe hard to express bladder.
Okay.
And you might see other nerve-related signs too, like a weak tail. Maybe they don't react if you pinch near their anus, or they're wobbly when they walk.
Right. Other clues suggesting nerve problems. What about that common urethral incompetence in spayed females? How does that usually look?
That's typically intermittent leakage. Often happens when they're relaxed or sleeping, or maybe as they stand up after lying down.
The leaking when sleeping is classic.
Very classic sign.
Yeah.
And usually on exam, their bladder feels pretty small, or at least not overly full, and there aren't other obvious neurologic or physical issues.
Okay. What if it's that urine pooling thing from, say, a vulvar fold?
Then you might notice small drips of urine just after they've finished urinating normally, like a little post-pee dribble.
Gotcha. And the twitchy bladder, the detrusor instability?
Signs there can be similar to urethral incompetence leaking when resting. But you might also see them needing to go outside much more often, or seeming really urgent about it. Increased frequency and urgency.
Right. And for male dogs, you mentioned prostate issues.
Yeah, if a male dog has incontinence, possibly linked to his prostate, you might also see him straining to defecate, maybe some hind limb weakness, signs of pain when peeing, or going really frequently, but just small amounts.
And the vet would check the prostate during the exam.
Absolutely.
Yeah.
Feel if it's enlarged or painful. And of course, if there's a vulvar conformation issue causing pooling in a female, the vet can usually see that physical abnormality.
So the history you give the vet and the physical exam are super important starting points.
Crucial first steps, yes.
But presumably you often need more tests to confirm things. What diagnostics are used?
Yeah, a full workup is usually needed. Starts with blood tests, CBC, and biochemistry. These help rule out or identify underlying diseases that could cause excessive drinking, like kidney disease or diabetes. And urinalysis is vital. We look for signs of infection, white blood cells, red blood cells, bacteria. And again, we check the urine concentration, the specific gravity.
To see if polyuria is part of the picture. Any other lab tests?
Well, in cats with incontinence, we definitely test for feline leukemia virus, given that link due to detrusor instability.
Right.
And in dogs, if we suspect a urethral issue or see signs of infection on the urinalysis, a urine culture is important to identify the specific bacteria and choose the right antibiotic.
Makes sense. What about looking inside? Imaging, x-rays, ultrasound?
Imaging plays a big role. Contrast x-rays, where we use special dyes, are really useful.
How do they work?
The dye highlights the urinary tract kidneys, ureters, bladder, urethra on the x-ray. Great for finding structural issues like ectopic ureters, especially in young animals or after trauma. There are different techniques like excretory urography or even contrast CT or MRI for super detailed views. For looking closely at the vagina, urethra, and bladder neck, especially for ectopic ureters, there's retrograde vaginorethography. And double contrast cystography gives really nice views of the bladder lining itself.
Lots of options there. And ultrasound.
Ultrasound is fantastic too. Non-invasive, great for looking at the structure of the kidneys and bladder, checking for stones, masses, inflammation, fluid buildup, even signs of kidney infection.
So imaging helps see the structures. Are there procedures to test function or look directly inside?
Yes, a detailed neurologic exam is key to check reflexes and sensation related to bladder control.
Mm-hmm.
Passing a urinary catheter can check for blockages if we suspect retention. And then there's cystoscopy.
Using a camera.
Exactly. A tiny camera on a flexible scope goes up the urethra to let us directly see the lining of the urethra, the bladder, and critically, where the ureters are opening into the bladder.
Mm.
Really helpful for diagnosing ectopic ureters or other subtle abnormalities inside.
Wow. Okay. So a whole range of tools, from basic urine tests right up to cameras inside the bladder to figure out the cause.
That's right. It allows for a tailored approach.
So once you have a diagnosis, what about treatment? What can actually be done?
Treatment really follows the diagnosis. The first step is always to treat any underlying cause if possible.
Like a UTI.
Exactly.
Yeah.
Clear up the infection. Or manage the neurologic disease if that's the primary issue. If it's an anatomic problem like those ectopic ureters or maybe a congenital urethral narrowing.
Surgery.
Surgery is often the main treatment, yeah. Trying to correct the plumbing, essentially.
Yeah.
Sometimes laser ablation can be used for ectopic ureters that tunnel within the bladder wall.
Okay. But what about the functional problems, like the weak urethra or the twitchy bladder? Is that medication?
Yes, for those functional issues, medication is usually the cornerstone of treatment. Sometimes it's used alongside surgery, but often it's the primary therapy.
Are there other non-medication options for, say, weak urethras?
Yeah. Sometimes injectable bulking agents like collagen or historically Teflon can be injected into the urethral wall.
It's to sort of bulk it and help it close, but
That's the idea, yeah. Create better closure. And for really difficult cases that don't respond well, there are more complex surgeries like colposuspension, which changes the angle of the bladder neck, or even placing an artificial urinary sphincter device.
wow. Okay, but let's focus on the medications as they seem common. What drugs are used for that weak urethra, the urethral incompetence?
Okay, so for that, very commonly, we use drugs called alpha-adrenergic agonists. Phenylpheniramine PPA is a very common one. Also ephedrine sometimes.
And how do they work?
They basically stimulate receptors in the urethral muscle, causing it to tighten up, strengthening that valve.
Okay, what else?
Reproductive hormones can also work. Short-acting estrogens for females, sometimes testosterone for males, though used less often.
How do hormones help?
They seem to improve the health, tone, and responsiveness of the urethral tissues, make them better at holding closed.
Can you use both types together, the PPA and the estrogen?
Yes, sometimes they're combined because they work through different mechanisms, potentially giving a better effect together.
Interesting. Any other drugs for urethral issues?
Well, for really tough cases, there are longer-acting injectable hormone options, like deslorelin implants. And another drug sometimes tried is impremine.
Imipramine. Isn't that an antidepressant?
It is a tricyclic antidepressant,
Yeah.
but it also has effects that can increase urethral resistance and relax the bladder muscle a bit, so it can be useful, especially if there might be a behavioral overlay.
Okay, quite a few options there for the urethral side. What about the other main functional issue, that overactive, twitchy bladder muscle detrusor instability?
Right. For that, we need drugs to relax the bladder muscle. These are typically anticholinergics or antispasmodics. Oxybutynin is a common one.
So they stop those unwanted contractions.
That's the goal, yes. Calm the bladder down.
Mhm.
And just to circle back, if prostate disease is causing secondary incontinence in a male dog, treating the prostate problem itself is the primary approach.
Got it. So medications targeting either the outlet valve or the bladder muscle itself. Are there times when these drugs shouldn't be used? Contraindications.
Oh, definitely. Important considerations. For example, estrogen generally isn't used in young females, intact females, or males due to potential side effects.
Okay.
Those alpha-adrenergic agonists, like PPA, need to be used very cautiously or avoided in pets with heart disease, kidney disease, or high blood pressure, because they can potentially worsen those conditions.
Right.
And the anticholinergics, like oxybutynin, should be used with caution in pets with glaucoma or certain heart rhythm issues.
So underlying health is key. What about general precautions or side effects to watch for?
Yeah, all meds can have side effects. Long-acting estrogens, though effective, do carry a small risk of causing signs of heat or rarely bone marrow suppression, which is serious. So lowest dose, shortest time if used.
Okay.
Testosterone can sometimes cause behavioral changes, aggression, mounting, and can worsen prostate problems or cause other issues. The alpha agonists, PPA or ephedrine, can sometimes cause restlessness, anxiety, increased heart rate, or hypertension. And the anticholinergics for bladder relaxation can sometimes cause nausea, vomiting, or constipation. So you need to monitor for those things.
Absolutely. Close monitoring and vet communication seems vital. Any major drug interactions people should know about?
Yes, always tell your vet everything your pet is taking. A key one is not to use tricyclic antidepressants like imipramine with MAO inhibitors, which are sometimes used for cognitive decline,
Okay.
and combining those alpha-adrenergic agonists with tricyclic antidepressants can increase the risk of developing high blood pressure. So vet needs to know the whole picture.
Good to know. So, once a pet starts treatment, what's the follow-up like? And what kind of success rate can people expect?
Regular check-ins are important. Initially, close monitoring for side effects, especially with the alpha agonists. If they're on long-term hormones, periodic blood work might be needed. Regular urinalysis, maybe urine cultures, are often part of managing things long-term to catch infections early.
And does the treatment usually work?
The good news is, yeah, medical management is often pretty successful. The sources suggest maybe 60 to 90% of pets have a good response to the initial medication chosen.
That's encouraging.
It is. Once things are well controlled, the goal is usually to slowly taper the dose down to find the minimum effective amount to keep them dry.
And if the first drug doesn't work well enough?
Then combination therapy like PPA plus estrogen might be tried, or switching to a different class of drug, or considering those surgical or injectable options we talked about.
Right. Are there common complications even with treatment?
Unfortunately, yes. Recurrent urinary tract infections can be an ongoing issue for some incontinent pets.
Because the urine leakage provides an environment for bacteria.
Partly, yes. And sometimes the underlying condition affects normal defenses. Also, urine scalding skin irritation from constant wetness can be a problem needing management. And sadly, in some pets, despite best efforts, the incontinence might persist to some degree.
So it's about management and improving quality of life, even if a perfect cure isn't always possible.
Exactly. It's often about finding the best approach to manage the condition effectively.
Okay, so wrapping this up, it sounds like urinary incontinence, while complex with lots of potential causes. Well, there are usually good diagnostic paths and effective treatments or management strategies available.
That's absolutely the main takeaway. It's a multifaceted issue, yes, but between diagnostics and the various medical and surgical options, we can often significantly improve the pet's comfort and quality of life, and the owners too.
Which really underscores why seeing your vet is so critical if you notice those suspicious wet spots. Don't just, put down more puppy pads.
Please don't, yeah. Get it checked out. An accurate diagnosis is key to finding the right solution for that individual pet. Your vet is there to help figure it out.
Definitely. So as we finish this deep dive, it really is quite amazing to think about everything that has to work perfectly. Anatomy, nerves, hormones, just for bladder control, something we take for granted.
It's incredibly intricate when you break it down.
It makes you wonder, doesn't it? What other everyday bodily functions rely on such a complex and delicate interplay of systems that we rarely even think about? Something to ponder, perhaps.